Moving on to the lungs, it's worth remembering the adventitious sounds which may be heard on auscultation of the dog and the cat chest. These are very similar to those recorded in large animals, namely rhonchi, emphysematous crackles, and rales. It's worthwhile noting that pleuritic rubs are extremely uncommon in the dog and the cat. Chronic bronchitis occurs as a common problem in the dog, especially in association with long-term dental disease. These cases will present with a history of persistent coughing, which is frequently associated with emphysematous crackles as a result of this persistent coughing. One difference from the pattern of coughing noted with endocardiosis is that in bronchitis, the cough is much commoner throughout the day and indeed can occur at any time, whereas with endocardiosis, it is much commoner at night. Another form of bronchitis which is common in the dog is acute bronchitis, associated with the so-called kennel cough syndrome. This is really a dustbin term which covers a multifactorial disease associated with viruses and bacteria. It's a common disease which does present with a really harsh, dry, paroxysmal cough. Many owners present these cases because they're convinced that the animal has an obstruction within the throat. A useful tip when examining these cases is that when the trachea is pinched, it will induce a paroxysmal bout of coughing in these dogs. Unlike bronchitis, pneumonias, both acute and chronic, are uncommon in both the cat and the dog, although of course they do occur in association with certain conditions, for example distemper, or secondary to cat flu infection in the cat. Before finishing with the chest, one little tip as regards diagnosis of trauma. It's very common, especially with cats, to be presented with a dyspneic cat, and you're really not very sure what's been going on because cats tend to have this free-living lifestyle. So a useful tip is to look at the nails. Does the cat have broken, cracked nails? If it has, then this is a strong pointer that they may have been involved in some form of trauma, and a useful pointer to look for the chest conditions which may be associated with trauma in that species. Having discussed the chest, let's jump over the diaphragm and move into the abdomen. Now, vomiting and diarrhea is a very common clinical sign in both the dog and the cat. A recent survey indicated that gastrointestinal problems were the second commonest reason why dogs and cats were presented to veterinary surgeons after skin disease. Vomiting is particularly common in the dog, and it's just as well that the dog has a very sensitive vomiting centre. It's been shown that the vomiting centre in the dog is something like 1,000 times more sensitive than that of the cat. And as I say, because of the non-selective appetite exhibited by most dogs, they need this sensitivity to be able to get rid of all the rubbish that they tend to consume. Moving on then to vomiting as a primary disease, undoubtedly the commonest cause of vomiting is transient gastroenteritis. Now, you're all well aware of these cases. They're, as I say, transient, self-limiting, and they don't usually require any treatment. The trick is determining when you have to move in with more detailed therapy. In other words, when is the animal becoming dehydrated? And the classic signs to look for in the dog are, firstly, is there a bubble forming between the conjunctiva of the lower eyelid and the sclera? Secondly, when you run your hand along the inside of the mouth, does the mucous membranes feel tacky and dry? And thirdly, when you tent the skin on the back of the neck, does it immediately spring back into place or does it stay there? If you do have an animal exhibiting these changes, then you can say that it's lost somewhere between 8 and 10% of its body weight, and that animal is in need of rehydration and intensive fluid therapy. As regards actual palpation of the abdomen, I'm going to divide the abdomen into three regions arbitrarily, namely anterior, mid-abdomen and posterior abdomen. If we look first of all at anterior abdomen, undoubtedly the commonest mass you'll appreciate in this region is enlargement of the liver. And in actual fact, other masses in this area are uncommon, as pancreatic masses rarely grow very large and are usually tucked under the costal arch, and the same is true of masses affecting the stomach. One mass which you may feel in this area is the classic curved sausage associated with an intussusception. As the intussusception is normally at the ileocecal colic junction, this will extend forward into anterior abdomen and may be palpable in that area. Secondly, some forms of intestinal foreign body may stick in the duodenum, and you'll feel the foreign body present in anterior abdomen. With all lesions at the front of the abdomen, it's much easier to palpate them if you elevate the dog's forequarters. By elevating the forequarters, the viscera then drop and it is much easier to palpate this region. Moving on to mid-abdomen, undoubtedly the commonest mass palpable in mid-abdomen is the spleen. Now, enlargement of the spleen is not necessarily pathological. It's very common indeed to get idiopathic splenomegaly in the dog, especially the older dog. And this is usually appreciable as a sharp-edged, distinct, parallel-sided object in ventral abdomen. However, it should be remembered that neoplasia of the spleen is a very common finding in the dog especially. And this may vary from a discrete spherical mass within the spleen right through to the really huge lesions of splenic hemangiosarcoma. And as you can see in this slide, it may be difficult to lift these massive organs. An interesting finding to note is that with both hepatic and splenic hemangiosarcomas, they may present as an anemic animal, because it's not uncommon for these tumours to rupture and bleed into the abdomen. So the clinical presenting picture may be of an anemic animal with a distended abdomen. And there is undoubtedly a breed instinct in the German Shepherd dog. Moving higher up in mid-abdomen, one may be able to appreciate the kidneys. In the cat, the left kidney is almost always palpable. In the dog, you'll only really feel the left kidney if the animal is thin. In the cat, once again, it's possible to palpate the right kidney by inserting a finger behind the 13th rib on the right hand side and pushing anteriorly. And using this technique, it is possible to run your finger down the posterior pole of the kidney. It's worth noting that in the dorsal abdomen, adrenal and ovarian masses are uncommon in both the dog and the cat. A common mass palpable in mid-abdomen is the discrete mass associated with an intestinal foreign body. These are common in the dog, but uncommon in the cat. And if you can feel a distinct, palpable, movable mid-abdominal mass in the cat, it's much more likely to be associated with intestinal neoplasia. Moving on to posterior abdomen, the commonest organ is the bladder that you're routinely feeling. In both the dog and the cat, one can readily palpate, and it is possible to slip the bladder between your fingertips and appreciate the thickness of the wall. And so one can easily detect cystitis, thickening in cystitis, or a neoplasia, for example, two common changes. The bladder is also affected secondly to urolithiasis, and this will usually present differently in the male and the female. In the dog, with a complete urinary obstruction, you'll obviously get enlargement of the bladder, and the same is true of the cat. In the former, it's usually associated with stones obstructing lower down the urinary tract, especially at the os penis. In the cat, however, it's usually associated with feline urolithiasis syndrome with obstruction at the end of the penis. In the bitch, however, it is usually possible to palpate the actual stones which form within the bladder itself. And this can vary between a single large calculus or, more commonly, multiple calculi. And in this case, one can palpate the bladder and feel crepitus due to the stones grinding against each other as you palpate the bladder. Another organ routinely noted in posterior abdomen in the male is the prostate. Only in the dog though, you don't usually feel the prostate in the cat. This is normally located intrapelvically and so will only be appreciated on rectal examination. If, however, the prostate becomes enlarged, then it tips forward into posterior abdomen and can be detected by pressing upwards with the fingertips towards the pelvic brim. Prostatic enlargement is common in the dog, especially from middle age onwards, and it is said to be much commoner in the Scottie than in other breeds. Obviously, palpating the prostate does not tell you whether it's a benign lesion or a malignant lesion or a prostatic cyst. In the female animal, the uterus is not usually palpable. In the pregnant animal, you can usually palpate fetuses around about 3 to 4 weeks into gestation. But after that time, one tends to have a fluid-filled, soft uterus which can be difficult to palpate. And this is why that even grossly enlarged uteri, for example, associated with pyometra, can be difficult to appreciate on abdominal palpation. When discussing the male dog, it's important to note a very basic point. Always look for 2 testicles in the scrotum. Neoplasia of retained testicle is very common in the dog, less so in the cat. But if you note that there is only 1 testicle within the scrotum right at the outset, then this may help you come to a diagnosis of an abdominal mass. Having discussed the presence of palpable masses within the abdomen, we'll now move on to look at air. Now, a wide range of presenting signs are associated with air in the abdomen, and undoubtedly the most dramatic presentation is the gastric dilatation torsion complex seen in the dog. Now, these cases present as a profoundly ill, recumbent, shocked dog with a large tympanitic distended viscous